have a real fancy hand name thing here that take it as you want to sit down so that it wasn't me. You can actually read it. This is Rick Bonds. We have a little fancy hand packet for you. Identifying who you are.
Next to my friend Amanda.
Take your appropriate hand packet. Make sure you're sitting down here. Just try not to bring it. So you can leave them there, or you can take them out. You guys need anything? You need something to drink water? Extra water?
I'm just Reverend Beth.
Padre?
Sure.
Padres? Is there a female version of that?
Well, it would probably be the Reverend Mother. Tonight. I'm Reverend Beth Walden, the pastor here at Central Square Congregational Church, United Church of Christ. I want to thank you for being here because this is an issue that we've been talking about in our church for some time now. Every week in our prayers in the life of the church, somehow this is coming up, and it's gotten to a point where we have to come together as a community if we're able to do anything to make any change to support each other and to combat what's going on right now with addiction in our society. So a couple housekeeping things before we begin. One is the bathrooms are right through that door. And if you need to go, we're not going to even look. We won't even watch you walk that way. Everybody poops. Number two, we've got 4 exits, also an elevator right through this door if you need to get out for any reason at all. Also, let's see what else. Yeah, I guess that's about it. I'm going to introduce our guest speakers. Yeah.
Talk to them.
Why don't you? You're right there. Go for it. I'm sorry? Oh, we are live streaming right now, and you can, if you're watching from home, you can email in questions when we get to the question and answer section. Is that good? All right, okay. So what we wanted to have was a place where we could gather resources. So the back of your program has some general resources. Also, we have resources right here. And this is kind of, again, the whole point of the evening. So if you look at our program, you can read who all we have with us, and then there's little bios here. And I think we should get started. So let's start with Mr. Rich Barnes. Rich, would you be willing to introduce yourself? And
Hi, my name is Rich Barnes. I'm very grateful to be here tonight. I don't think I need a microphone. I do? Okay. My name is Rich Barnes. I'm very grateful to be here. I see a lot of people in this crowd. I'm a recovering addict. I'm in my 10th year recovery, and I do whatever I can, whatever in my means to prevent someone from going down the same road that I went down for many, many years. I have a website. I speak at schools, wherever I can, in order to, again, try to save that one person from going down the same road. My website is www.richfulthinking.com, and on it is my phone number if you have any questions, my email. I don't hide. I don't hide from anyone. If anybody has a question, anybody has a concern, you can always call me. I'm open to anybody that needs it. I'm grateful. I'm grateful I'm here. I got sober and clean back in 2006. My life was decimated by addiction. And when I spoke at Oliver Ames High School the other day. It was 1,200 kids. And I told them what I'll tell you. I sat, and I wish there were more kids here. I sat right in those auditoriums when I was a young kid and never listened to a word, because addiction is never going to happen to me. It's never going to happen to me because I'm going to be okay. See, addiction, and right now we're facing an opiate crisis. Heroin's killing a lot of people. And if you lost a loved one, I tell you right now, my heart bleeds for you. And my deepest sympathies to anyone that lost a loved one from this disease. 3/4 of the people that are alive today know some or have been affected by the disease of addiction. And addiction is a disease. It's deemed by the American Medical Association as a brain disorder. And when I got clean in 2006, my whole life changed. And the 28 years I was out there, I never knew I had a problem. Never knew it. I didn't listen to anybody because I didn't have a problem. The people who reached out their hand to me, I didn't accept it. And the three words three of the hardest words for anybody to say, the three words are, I need help, because it takes a mountain of humility. But again, I sat in those seats, and nothing, I can tell you right now, it was never going to happen to me. Addiction is like a soft hand. And I say this a lot. Addiction is like a soft hand that strokes your arm, and tells you everything's going to be okay, that nothing is going to happen to you. Go ahead, take that pill, drink that alcohol, do whatever, smoke that weed. And the biggest perception that I've heard in the last several years since this happened is that marijuana is legal, which it's not. It's decriminalized. I don't know the exact laws, but you still can't walk around smoking weed. And if you want to know the gateways to addiction, really, it's the home parties that people have. It's the alcohol. It's the marijuana. These are the things that I started off with when I was a kid. And that soft hand started stroking me. And don't worry about that loss, Rich. You know, and as my addiction grew, you know, as the trouble started happening to me when I was 16, 17 years old, the arrests started coming. My grades started to fall. That hand kept telling me I was okay. Don't worry about it, Rich. And I'm saying to myself, okay, no problem, you know, and I kept going. I got kicked off my high school hockey team as a senior. I lost so many things, and again, nothing was ever going to happen to me. And as that addiction kept going on and on and on, because addiction is a progressive disease, all of a sudden that soft hand now sprouted claws. And claws came out and had me stuck. And my addictions grew. I started doing cocaine, I started smoking crack, and I started doing a lot of things that were not of a normal person. And I was blindfolded by addiction, because addiction is very cunning. It tells you you're okay, and it keeps telling you you're okay. And my addictions lasted up until 2006. And in 2006, 28 years of drinking alcohol and 21 years of using drugs, it led me to suicide. It led me to suicidal thoughts, and I almost did it. There's only 3 places that addiction will take people if you continue to use. And that is jail, institutions, or death. And I was 37 years old in 2006, and I'm ready to kill myself. I had the butcher knife on my wrist. And this is, again, the progression of the disease of addiction. Tells you you're okay, and now I'm going to kill myself because of that addiction. Too many people today don't really, I'm looking at this assembly here tonight, heavily advertised. And I'm a firm believer that addiction is so prevalent in our community, and not only our community, but nationwide. that my thinking, my thought process should say, we should have a football field stadium full of parents that want to know about what's going on. But what happens is, addiction is the pink elephant that flies around the ceiling. Everybody knows it's there, but no one wants to talk about it. It's not my kid. Well, guess what? If we don't educate our children, if we don't talk to them, a drug dealer will. A drug dealer will. Or someone that peer pressures them into taking that first drink, or that first pill, or that first smoke of that weed. Someone will get to your kid, no matter who it is. And I'll tell you right now, I'm scared out of my wits. I have a 7-year-old little baby girl and an 11-year-old girl, and they are my heart and my soul. They're the blood that goes through my veins and the air that I breathe. And without them, I'm nothing. And I'll tell you right now, I will educate them. I will tell them what's going on with life. I will tell them all about drugs, and I'll just pray nothing happens to them and no one gets to them before I do. That's what I want for my kids. And while 80 or 90, 100 people here today, we could take what we learned today from all these people up here, or even that you share, and we could spread that out like wildfire. We could spread awareness everywhere. We don't have to have it right here encapsulated in this church. We could tell everybody about it. Addiction does not discriminate. It takes anybody from a CEO of a multi-billion-dollar company all the way down to the person who eats out of that dumpster. It doesn't care. It doesn't care. It took me. I was a normal kid, played hide and go seek, kicked the can, hockey, football. I'm suicidal at 37 years old because of my addictions, because I couldn't reach out that hand. I'm not asking you tonight. I'm actually pleading and begging with you from the bottom of my heart. Spread awareness about addiction. Addiction affects 3 quarters of people somehow, some way. It's a ripple effect. I can't count. I need more hands, more fingers, and more toes to count the friends that I've lost from addiction, that went out there one more time, that couldn't reach out that hand and say, please help me. If we want to help the 25, the 30, the 35-year-old people, we need to help them now when they're 12, 13, 14, 15, 16 years old. We need to give them guidance. We need to help them along and show them the ropes of what's going on. We need assemblies like this all over the place. We need constant vigilance, constant awareness, constant education, everything that we can do in our power. No rock unturned till we save that last kid. I hope in my heart tonight that this assembly saves one kid, just one person, because we owe it to them to spread what we know about addiction. I'm up here tonight, 28 years of addictions for me. I'm not embarrassed by it. I did some pretty horrid things. But my addictions led me here to spread awareness of what I went through so one kid, one person, one human being, one life can be spared. Again, I'm just going to leave it with this. I hope and pray that what you hear tonight saves someone, and what you hear tonight you'll spread like wildfire, because it's not just in Bridgewater. It's everywhere. You know, when I spoke in Easton, I had about 6 or 7 emails from kids, and all of them told me how much weed they smoked. Oh, this one's giving them this, and I don't want to do that. These are kids. I spoke in Haverhill, Massachusetts, to an 7th and 8th grade middle school. An 8th grader comes up to me after I spoke. This is last year, crying, hugging me. I didn't know what to do. She's hugging me. I said, well, you okay? She said she overdosed 2 weeks ago, an 8th grader. It doesn't start when they're 12. It doesn't start when they're 18, 19 years old. It starts early. We have to stop this epidemic. Remember one statistic. 3.44 people died every single day last year from addiction. How do we get that down to three people? How do we get it down to 2.5 people? By doing this stuff tonight, spreading awareness everywhere. I thank you all for being here tonight. Again, spread it around. Take that pink elephant down and talk about it. Because the only way we're gonna end it or put a curve in it is by speaking about it. Passionately, openly, honestly, and vigilantly. That's the only way we're going to stop this epidemic. Thank you.
Thank you. All right, next up we have the Chief of Police, Christopher Del Monte.
How's that? Well, good evening, everyone. My name is Chris Del Monte. I'm the police chief here in Bridgewater. And first, let me thank you for being here tonight and taking your time. We've had other forums in the past on a smaller level. I'd like to thank everybody from the Central Square Congregational Church for their work to bring this out on behalf of the community. And I think from what you've just heard from Rich, we all know that this is a significant problem. We all know that we have a serious issue that is not unique to Bridgewater, first of all, but we as a community don't have to sit there and take it either. We should be doing something more than we're doing. I can tell you as a police agency, 25 years ago, I knew what our mission was, and that was to arrest our way out of a drug problem. Today, that doesn't work. We have to do more. Police agency is responsible for the welfare of this community. That's part of our mission. It is beyond simply arresting our way out. I can tell you that we do things differently. We've adjusted our own policies as one agency amongst many. I look forward to the question and answer period that you have for us and everyone else here on the panel. You have some really experienced people up here that will really add some insight, I hope, and I think they will really give you some better understanding of the significance and the magnitude of the problem. I just wanted to introduce a couple of people. Officer Scott Heil and Officer Kyle Montagano are in the back as well. The reason these gentlemen here is because not only are they clearly younger than me, but that is also significant. That is a change in how we operate. They're here because it's, as I said to you, a different generation. We do things differently, and this problem has forced us to change some of our policies. Now, what are we doing as a police agency, literally? I can tell you in the last probably 2 to 3 years, we've done a number of things. Job one, saving lives. What can we do to make a difference from those people that are suffering from addiction? Now, as you know, as Rich has said very well, this is a complex problem. This is not simple. We have instituted a Narcan program. I didn't think I would see the day when police officers would actually be administering drugs to people, because that's what it's come to. We have to save people's lives. It's as simple as that. Unfortunately, the problem is so widespread that now all of our police officers carry Narcan. I can tell you since January 1, we implemented this in 2014. Just since January 1, we have used it about 38 times on different people in a variety of circumstances. Unfortunately, the statistic that also goes along with it, as you know, is we've also had 7 fatalities that we couldn't save. The problem is very widespread. There are a number of reasons for it. And as I said to you, as a police agency, it's our job to look out for the welfare of our community and what can we do. So I am looking forward to the question and answer. I should have also mentioned to you in the beginning, I apologize to you ahead of time. I do have to leave for a period of time. I have to attend a town council meeting tonight. But this is my pledge to you. I will be up there for a short amount of time. I will return. I want to hear what you have to say. What things can we be doing differently than we're doing now? I can tell you on the social service side of things, aside from policy, we've also reached out to social service agencies. You'll hear from Amanda briefly. We're now included in the Brockton area Substance Abuse and Opioid Coalition. We're trying to do more with garnering services or directing people in the right way. Where can we get people help? How can we do that? I think it probably sounds easier than it is. One of the problems that we have, and you're going to hear it tonight, is deals with treatment. It's not only about education. There's a treatment problem as well, and getting people who are suffering from addiction the services that they need as well. And that's a problem for us too, because we're dealing with people out in the field, and oftentimes there's not a lot of time to remedy situations. You know, we're a temporary measure to try and get people help. And as I said to you, saving lives is really that priority. I can tell you one experience that I had about 10 or 12 years ago. You know, we had parents that came in and said, hey, there are things that are happening in my house. I may be missing money, I may be missing property. There were some other telltale signs, and every one of those parents that came into us, they thought they were unique. They thought they were the only ones. And in reality, it was the same story over and over and over again. And there were only a few things that we as a police agency could do for them. We hadn't we hadn't partnered as closely as we could have with those social service agencies. We hadn't recognized how significant the problem was, and of course it has gotten worse. But there was one person that believe it or not, that I got actually through the newspapers. Usually they're not telling us much. They're always asking us a whole lot of questions. But one thing they did tell me was, there's a parent out there who's doing something about this problem. Her name was Joanne Peterson. I don't know if anybody is familiar with Joanne. But at one time, Joanne was all by herself. And she invited me. I communicated with Joanne. She was a parent of a child who was suffering from addiction. It was a long road for her. And she was just one mother amongst many other stories that we had heard over and over again. And I was enlightened when I talked with Joanne. This is more than a decade ago. And I remember she invited me to travel up to Norfolk County to the district attorney's office. It was the only place that was supporting her efforts as one parent trying to educate other parents. As you know, Learn to Cope, there's some materials out in the back for you as well, has become an instrumental resource for many people out there who are suffering. And what I walked away with was, one person can make a difference. Joanne is one of those people. I don't know if you've seen the growth of the program that she runs, the services that she puts out there for other parents. I know I believe it was this past year at the President's address, she was up in the gallery. And at one time, she was all by herself. There was nobody else out there. There were many people that were struggling, but nobody that had really taken the football and was trying to move it forward a couple of yards. So with that said, I want to get to our other speakers here. As I said to you, I do apologize. I will have to leave, but I promise you I will come back. I'm interested to see what you have to say. Thank you.
Next up, we have Derek Swenson, the superintendent of the Bridgewater-Rainham Regional School District.
Thank you. And it's an honor to be here this evening. I come from Fall River, Massachusetts, where this epidemic is not new. It's something that's impacted me on a personal level through family and friends. I've lost several friends to this epidemic, so it does hit home with me. And now it's starting to impact the new community that I call home. That's why I feel as though it's important for me to be here this evening. I represent the school system, and our job is to educate. And I feel our role in this is to educate our students, but to educate our parents and community members as well. I heard Rich talk a little while ago about these type of meetings, and I am so proud of the people that are sitting here this evening because it's a situation where we try so hard to promote these type of events, and we usually get a turnout of even less than this. And it's disheartening because I feel as though it's due to possibly the stigma that's involved with these type of events and activities. That the stigma is you have to be a parent or you have to be someone who is living through the struggle in order to attend one of these meetings. And that's just not the case. I believe in being proactive rather than reactive. And I think that's what we as parents and community as a whole needs to start doing, be a lot more proactive in the way in which we handle these situations in this crisis. Growing up, I had friends, and it would start first with finding out who had recently had their wisdom teeth out or an operation and where those pills were, and going to those homes and going through the medicine cabinets. And then it progressed when OxyContin hit the streets to that, and then when that became too expensive, it was heroin, and then in the end, as Rich said, it was either death, jail, or institution. And I want to, as a member of the school committee, do whatever we can to prevent these things happening from our next generation of students. We are planning a opiate awareness week in March at the high school. I highly suggest that folks attend. You don't need to be parents of school-age children in order to attend these meetings. We have promoted already on our Facebook page. We have posters and flyers throughout our community, at the high school, on our website. It's a week long. There's one in the back of the room as well. It's a week long. We're having folks from the DA come in. Tim Cruz will be there. We have many impactful speakers that will be talking to our students during the day and during the evening. And we ask that you please pass the word about that. One thing that Chief Del Monte talked about was changing the practices of the police and law enforcement and not arresting your way out of this issue. As a school district, we need to change our ways in which we're handling these situations too, and we're identifying students that may be using. And I am of the belief in the philosophy that we have to have more of an empathetic approach rather than punitive. Punitive doesn't cure the situation. Being empathetic and sympathetic to the students in our care does. And what we have really tried to do is, when we identify a student who may be using, who may be struggling with addiction, is to reach out to the resources that we have outside of our community or within our community itself. One of those great resources we have is a program called Independence Academy. And Independence Academy is a high school that when we identify students who may be struggling with addiction, that we reach out through North River Collaborative, which we are a partner with, and we have the students enroll in Independence Academy. And during that time, they receive the education they would receive in a regular general ed public education classroom and setting. However, there is a recovery piece to it as well. And they are provided the supports that they need in order to help them with their struggles. So I would encourage you as parents, if you feel as though you have some issues with your children, you're starting to identify that they are using or struggling in any way, please reach out to the folks at the high school and allow them to work with you so that we could possibly get them a placement in Independence Academy so that they can still continue on with their education and at the same time receive the supports they need in terms of their recovery. So if you have any questions at any time, you can always give me a call or you can email me at any time, and I'd be happy to assist you in any way. So thank you, and thank you for allowing me to be here this evening.
Up next, I'd like to welcome Rich Canizo, a pharmacist.
My name is Rich Canizo, pharmacy manager here in Walgreens in town. I've been working in Bridgewater now for going on 23 years. I was that naive teenager that you spoke of when I first started, and I never thought that I'd be sitting on a panel like this. This is not the Bridgewater that, as Chris has been around for many years, we've known. But we're not alone. It's not the only town in this situation. The entire Commonwealth across the country, we're all in the same situation. I'm just going to give you guys a little bit of brief information on opiates, some treatment options, and God forbid, some emergency options. Opiates are not new. They've been around a lot longer than any of us. The settlers used opiates in a natural form as poppy to relieve pain back in the 1600s. So the product itself is not new. The abuse potential, yes, is new. Traditionally prescribed for pain management. The way that it actually works in the system is it targets opioid and pain receptors in the body. When it attaches to these receptors specifically in the brain, that is when the people get that high, that buzz, that euphoric feeling. That's what draws them to the product. It's not the pain relief, it's the receptors in the brain that bring it back. For the sake of discussion, there's a class called opiates, which is an all-natural. It would be things like morphine and codeine. The opioids that we are used to hearing, the oxycodones, the oxycontins, the fentanyls, those are all synthetic varieties. They do work the same way in the body, just one is an all-natural occurring substance as opposed to a synthetic. For the sake of ease in conversation, we'll just lump them all into one category. Again, they bind to the receptors all over the body. The uses for these products can be anywhere from acute, as Scott was saying, Derek was saying, looking for those dental pills. They can be used for teeth extractions, short-term breaks, short-term strains, all the way up to long-term uses, long-term cancer, things like MS and other debilitating lifelong diseases. Fortunately, in years past, or within the last year or two, we have started to see some changes in the laws, changes in the prescribing patterns. The state of Massachusetts has provided us with a new prescription monitoring program, which pharmacies, physicians have access to. You can check patient profiles to make sure that they're not shopping from doctor to doctor, from hospital to hospital. The state of Massachusetts, and I believe the DEA nationwide, is starting to buckle down a little bit on physicians and their prescribing practices, limitations as far as quantities, number of prescriptions. While we are starting to see a decline in initiating therapy with them, we are starting to see a lot more long-term use. So while the doctors aren't necessarily beginning new therapies on people as free-willing as they would in the past, we're starting to see more and more people hooked in on long-term use. Somebody that may have been on something for 3 to 6 months for a relatively acute situation are now on these products for extended period of time, years life. Because of the lack in availability of pills on the street, the people are turning to the next best thing, which unfortunately in this case is heroin. It's probably the largest problem out there right now as far as the overdoses go. It's more readily available, and it's also a lot cheaper to buy than acquiring oxycodone or OxyContin pills. The unfortunate thing with that, I mean, you can overdose on either or. The unfortunate thing with the heroin is it's not a pharmaceutical grade product. There are a lot of impurities in it. They use impurities to cut it, to make it weaker, and they're also putting other products in it like fentanyl and other narcotics to better hook the person. They're figuring they're going to draw more sales if they get their hooks into the people. I don't want to get too much into the use of heroin. It's a little bit beyond the scope of what I do and what we're going for here, but heroin is classified as an opioid, and it does react the same way in the body as the oxycodones, the codeines, the Percocets, the things that everybody are looking for. I wanted to touch briefly on one of the treatment options for the dependent patients, buprenorphine, which is better known as branded as Suboxone. Came out quite a few years back now, but the way that works, it's also an opioid, and it attacks the same receptors that the opioids will attack. It has a higher affinity for it, so basically what that means is it's going to get there faster, it's stronger than an opioid, and it's actually going to block that receptor. So to have a Suboxone product in your system, it's going to stay in your system for approximately 24 hours, so that if the addict were to try and take a oxy pill or heroin, it's actually going to block the product from binding. So while it's in your system, it's bound to the receptors, it's actually helping curb the desire, curb the cravings, but it's not going to give you that euphoric high that you would get from a typical opioid. Now, over the last couple of years, initial treatment with Suboxone was intended to be a short-term treatment. The point behind it was to get on it, taper the patient down, and be rid of the substance altogether. Now, in some cases that may work, but in most cases we're finding, as Rich mentioned earlier, this is actually a disease. Diseases do not go away. They have to be treated. So what we're finding to see more now is long-term use of the Suboxone, even lifelong use of the Suboxone, to keep those cravings down, to keep the patients off of the opioids, and to give them more control. In years past, insurances have been a nightmare as far as covering the products, lots of prior authorizations, lots of paperwork, which by the time they get covered through the insurance, the patient's right back on an opioid, and we're taking 5 steps back. Most of the insurances have come around a lot in the last couple of years, put these drugs on their formularies, realize that there's a problem in place, and trying to move forward to help at least alleviate some of the problem. Initially, when Suboxone came out, it definitely had a bad rap. It's essentially, a lot of people would think, well, are they going to take the opioid, or are they just going to take the Suboxone? We're just putting a bandage on it. That's not the case. It's allowing these people to function without the peaks and troughs, the withdrawals, the overdoses. I've spoke to many clinicians, I've spoke to many patients, and they say that taking the Suboxone makes them feel normal. Unless you take an incredible amount of it, you're not going to get that euphoric buzz out of it. It just lets them function, which is basically what they're looking for. In a case like that, part of the Suboxone treatment is patient has to have a physician that's actually certified and registered to write prescriptions for Suboxone. It's not something that can be acquired just through their regular primary care physician. It also requires counseling treatment through the physician as well. In a worst case scenario, the one last thing I would like to talk on, as both Chief and Superintendent had mentioned, is naloxone. Now, in the case of overdose, naloxone, also known as Narcan, which, as Chief said, never thought you'd be carrying on your person, has become a savior in this day and age. It's buying the patient's time. If emergency services aren't there, I believe that they are carrying them, both fire, police now, fire departments in most communities, not police in all communities yet, but I think most of them are getting on board. School systems now, school nurses. I think I saw an article somewhat recently where a particular library in the area actually had it on hand as well. Don't have to be a medical professional to administer it. There is a little bit of training that goes along with it, but it's relatively straightforward and somewhat simple to use. Based on a collaborative agreement in the state of Massachusetts, I know my pharmacy, and I believe all pharmacies, if they were willing to sign on, are allowed to dispense naloxone under a written agreement through the state of Massachusetts. It does not require a prescription. It's just basically, if you have somebody in your family and you wanted to come in and get it, it is available to you. It can be billed off to your insurance. And it's not a fix, but it can save somebody some time if they're in a situation of overdosing. Along with that goes a little bit of training, goes out to the person at pickup. Information sheet I had shown to the guys up here basically tells you what to look for, how to utilize it. This is dispensed along with the product. So for people who have known addicts in their house, maybe in a situation where they need to administer it to save their son's life, their daughter's life, their father's life, their spouse's life, it can buy you a little bit of time until EMS can get to your house. EMS in town, all towns, is fantastic, but that 3 to 5 minutes can be the difference between life and death. As I said before, it's not a fix. It will buy some time. In any case of an overdose, you always want to contact 911. I just want to touch real quick on a couple of safety issues. I recommend first and foremost, you know what's in your home. We have kids, we have teenagers, they have friends. Kids rummage through medicine cabinets looking for those dental prescriptions. Anything that they can get their hands on, they're desperate. They will take whatever they can find. Know what's in your house. Lock up your medications. If you're on certain medications that may be somewhat desirable to visitors to your house, lock them up. Have a lockbox. It's not a bad idea. If you carry them on your person to take during the course of the day, take a few. Lock the rest up. Don't leave them out and about. Discard extra medications. You have that, again, dental prescription. The doctor gave you 15, 20 pills. You used 5. Get rid of them. There's no sense in having them in the house. It's not recommended that you use them for something else down the road when you tweak your knee or bang yourself up. Utilize the police station as well as a lot of police stations in the area these days have a med return drop box. It looks like a large green, right, Chief? large green mailbox right in the lobby. Peel your labels off, keep the pills in a bottle, and dispose of it in there. They're partnered up with the DEA, I believe, to dispose of any unwanted medication, so utilize those resources. Patient education, another one, it's huge. When you get that prescription, utilize your physician, utilize your pharmacist. Most importantly, don't be afraid to ask questions. The state of Massachusetts has implemented a new law upon dispensing of narcotic pain medications. It's an information sheet that needs to be dispensed with each and every opioid and pain medication that we do. It gives you an idea of the risks of overdose, how to dispose of your medications, what to look for as far as side effects and overdoses. Don't be afraid to utilize your resources. Education in this is everything. And that's about it. Thank you.
And up next is Amanda Sandoval, the Assistant Director of Prevention Services at High Point Treatment Center. Thank you, Amanda.
Thank you. So I'm going to talk a little bit. Do I have to stand? Okay. Okay. So I'm going to talk a little bit about what addiction actually is. Although it's so complex, I'm going to try and talk a little bit in layman's terms. And then how specifically opioid addiction affects our brain, and then what to look for and some of the signs and symptoms. So, as many of the people before have mentioned, addiction knows no bounds, and it does not discriminate. Although there are many stereotypes that are and stigma that's attached with addiction, there really is a new face to addiction, and it's affecting us all. It's not just an individual problem. This is a family and a community problem. So this is wonderful to see the community coming together tonight to learn about this information, because the more information that we have and the more education that we're providing to people, the less stigma will be attached to this disease, and more people will want to go out and get that help that they need. So addiction is a chronic relapsing brain disease, as everybody mentioned earlier. So when in active addiction, there's an impaired control over a reward-seeking behavior, such as seeking a drug, and despite any of the harmful consequences that come along with seeking that reward. So why do people use drugs initially? A lot of people, there's this negative connotation attached with drugs. You're always told just say no to drugs, but people take drugs to feel good. People take drugs to feel good. They take drugs to feel better. So a lot of people are self-medicating when they're taking drugs because they maybe have some mental illness, or they're trying to cope with their internal emotions or their stress. And then a lot of people take drugs to do better. So we see that a lot with stimulants or steroids. But no one uses with the intent to become addicted to a drug. No one ever said, I want to grow up and be addicted to drugs. So I know that it was mentioned before, what are opioids? Opioids are central nervous system depressants, so they slow down our ability to breathe. They can take away our pain, but they can also give a warm, euphoric, dreamy high. And so opioids or opiates, an example could be oxycodone, Percocet, Vicodin, Suboxone, as was mentioned, or heroin. And our brain doesn't know the difference between any of those. Our brain has receptors for opioids, so they all feel the same. But what's unique about opioid addiction is that you can become addicted after the first to the third time that you actually use an opioid. They go into our brain and they fit into receptors and immediately and permanently change the way our brain functions. And essentially what it does is it hijacks and rewires our brain. So because our brain is such a complex organ, our brain doesn't want our vital signs to drop, which is what happens when an opioid engages in the receptor. And our brain tells us that it's no longer normal unless there is an opiate engaged in that receptor in your brain. So anytime an opiate isn't in the brain, physical withdrawal occurs. And that's the reason why many people continuously use an opiate, because they are, despite any of the consequences that they're facing. So it's a drug of tolerance. So the more people use an opioid, the more they need to use in order to feel normal. A lot of people that are using opioids are continuously using them because they just want to feel normal. They don't want to feel sick. So what are some of the physical signs of somebody using an opioid? If they're in withdrawal, they might have flu-like symptoms. So that includes diarrhea, cramping, and vomiting. Their eyes might be really watery, sweaty. Opioids cause us to be really itchy. So you might see some itchy skin, or picking at the skin. The skin might be flushed. Runny nose. A really crucial indicator is that their pupils in their eyes are going to be really pinned. Weight loss and slurred speech and a drowsy nod looking may be the physical signs of being under the influence of opioids or in withdrawal. So if a parent or family member is concerned and they're seeing some of these signs, it's really important to go with your gut. I know with teenagers, people often think that, oh, it's just teenage behavior, they're just acting up, it's hormones, but it's really crucially important to go with your gut and seek that help if you are really seeing some of these signs. So some of the changes in behavior, loss of interest in their personal appearance and their hygiene, secretive phone calls and text messages, mood swings, really depression alternating with euphoria, talking really loudly, angry outbursts, staying up all night and then sleeping all day, missing valuables and money, and then lack of interest doing favorite activities or being around family and friends. So I know that this was talked about a little bit also, but addiction can start when somebody experiments with drugs, or they can be legitimately prescribed a medication for a surgery or an injury. And that's really, a lot of people are becoming addicted to opioids due to a legitimate prescription. So it's really important to get as much information about that medication that your child or loved one or yourself is being prescribed. You have every right to ask as many questions to the doctor as you want, and know the potential risks for addiction. If addiction runs in your family, it's really crucially important for you to be getting that information. And as you've just been told, opioids, it's been really a game changer where you can become addicted after the first time you use them. So it's just really crucially important to get that information. Do I really need to be prescribed this opioid, or can I take something a little less serious? Keep prescription drugs in a safe place, and we recommend locking them up. Get a lockbox if you have prescription narcotics in your home and you need to take them for legitimate reasons. Monitor the use of your child or your loved one's prescriptions and your own. It's important to know that 70% of the people who misuse or abuse prescription drugs got them from a family member or a friend for free. So it's really important to be monitoring your prescription drugs and locking them up if you have them. And then if you have any unused, unwanted, expired medications, get rid of them. There's no need for them to be in your house because they might end up in the wrong person's hands. So as it was mentioned before, there is a drug drop box at the police station right here in Bridgewater, and you can drop them off, no questions asked. You just go in and you drop them in, and that's it. And then they are incinerated by the DEA, or the Drug Enforcement Administration. So lastly, if your loved one is using, if some of these things tonight maybe raised a question in your mind, get educated like you are tonight. Get educated about the disease of addiction, because education, as I already said, that's a tool that you can have, and that's a weapon that you can use against the disease of addiction and the devastations that come with it. Find treatment for your loved one. On the back of your insurance card, there's a number for mental health and addiction services. Call the number on the back of it. I know it's been mentioned again that there really is a lack of beds in the state, but keep calling. Don't give up trying. And even if you don't have insurance, there are available beds within the state to get treatment. If you use any drug or alcohol, you're at risk for an overdose. So it's important to be ready in the case of an overdose. So be trained on rescue breathing and learn how to administer naloxone. You can get naloxone at Walgreens. You can get it at any Learn to Cope family support meeting throughout the state. There are many different means, and you can come up to me and talk a little bit afterwards if you think that you want to carry Narcan. And get support. Get support for you and your family, because it's just as important for you to get the support that you need as it is for your loved one to get the support and treatment that they need. As I mentioned, Learn to Cope, Al-Anon, Families Anonymous are all great resources in the local area. So thank you.
And then what I can tell you as a pastor of a church is that I can help with the funeral. It's morbid and we don't want to think about it, but that's where I come in. I am able to offer families resources where they can go to get help, but ultimately what I've noticed ends up happening is I help you plan the funeral. And I'm happy to talk with you about that and answer questions, but I hope that through this resource and through our time together, we can make it so that those numbers are reduced so that we don't have to have those funerals. And so at this time, I'd like to open it up to the floor for question and answers. We're gonna have three mics running around, so just raise your hand if you have a question, and try to make your question as simple as you possibly can.
I actually have one. Question. So if you have somebody in your family, or you have a friend, but I guess more specifically in your family, and you suspect that they have an addiction, right? You question and you hear, no, I'm fine and everything, but you suspect. What do you do first? How would you recommend you handle something like that?
Me. So I recommend going with your gut and going with that you think that if you think that there is a problem, go with your gut and seek out those resources. I would suggest immediately getting some resources to get into treatment, especially with opioids. They're going to need to detox. For adolescents, there's a treatment center right down the road, the Castle in Brockton. For kids 13 to 17, they can go and get detox and rehab. And there's also a High Point Treatment Center where I work in Brockton is another local detox right down the road for you to get treatment. If that person is unwilling or unable to go to treatment and they're an immediate risk to themselves or others, you can Section 35 them also and petition that at the court, which would be a mandate to treatment, a civil commitment, where the person would lose their civil liberties for up to 90 days, they say, but it doesn't typically end up being 90 days. So,
just to dovetail on that a little bit, I think if you're suspecting a child or I think you said child or kid is using drugs, I think you also have a better shot maybe asking them, just being right up forthright with them. And if, for me, my daughter's 11 years old, and I'll talk to her about drugs, and I want to have that open relationship with her, that if she, or even my other daughter, if they have a problem with something or someone's peer pressuring them, I want them to come to me and have an open, Socratic, soft relationship with them, but also a firm one that they can come to you and talk to you about it and say, listen, I've did this, or listen, Johnny Jones is telling me to take this at school, or develop a relationship as little as they are, as young as they are, to have that openness that they can come to you and just talk to them about it. If you suspect something, I think they may not tell you the truth. And also, I'll tell you right now, what can save their life is drug tests. Is drug testing them. Give them a drug test, and if they say go ahead, then they have nothing to hide. But if they say no, I'm not taking it, then something's wrong. And those drug tests are available anywhere, CVS, Walgreens, anywhere. You can, I believe, you can just, anything you can do to prevent someone from becoming an addict, whatever it takes. There is no, I don't think there's any boundaries. Because guess what? If you save them now, no matter how upset they get at you, they'll thank you later. Believe me. I wish I had that foundation when I was a kid. I wish someone asked me, or I wish I had that ability to have an open relationship with my parents to say, listen, I have a problem, and it would have saved years of my life. But I think you just be open. Maybe, again, if it gets to the point, there are drug tests, and I wouldn't be shy to use them, because you could, in reality, save their life.
Thank you.
And I would say if you have a school-age child who you're suspecting, and you have a difficult time possibly having that conversation, which I hope we wouldn't as parents, but we realize that some folks may have some difficulties in that respect, lean on our school counselors. We have school adjustments counselors, school psychologists, folks that have that background to help you with those difficult conversations, and also we'll have some resources within the community that you can reach out to as well. So lean on the schools for that as well, for that support.
I don't have a question. I just want to, you're the educational director of the school system.
Superintendent, yes, sir.
Something you said that's very important. I've been a recovering addict for 35 years, and one thing you're saying is the education. We have to listen to our kids differently now. My friend here just lost his sister and his brother-in-law a month apart from a heroin addiction. His 9-year-old niece said, what can we do to stop this? She had a fundraiser, a 9-year-old kid, to raise awareness of drug addiction. We have to listen to our kids. They're smarter than we think. It's, and I thank you for saying that, because we have to educate. And you mentioned stereotype addicts. You should have seen the looks I got when I walked in. I'm a Christian. But because I ride a motorcycle, I was stereotyped. Addiction is not the kid you see in the street anymore. It's in your home. And our kids are dying. I've been to 3 wakes in the last 3 weeks. Kids that are not going to see the age of 22. Yeah. We have to listen. But in order to teach, we have to listen to what they want to know. No more timeouts. I was listening to a song a friend of mine wrote years ago. He said that one last shot is a permanent vacation.
Thank you.
Derek, I know you talked about the high school program that you have going on. Sorry, I'm here. I'm not standing. Could you just further elaborate what's being done at younger levels as far as drug education?
We have to really start to look at those younger age students, because like Rich said, it doesn't start at 16, 17. So we have to really start to look at what our health curriculum is starting to bring in to the forefront. And this, with the opiate crisis, has moved so quickly that we now need to kind of revamp and revisit what our curriculum is going to address in regard to those areas. We do bring in a lot of enrichment type programs throughout the school year in terms of speakers and whatnot, and everything that we are offering at the high school in terms of education is open to our younger age students as well. It's not just high school related. So those events that we're going to have in March, we had 2 in December as well that really just weren't very well attended. We encourage you as parents. I know it might be difficult to sit in a room like this with your child and hear some of these things that are happening, but I would again encourage you, like the gentleman said, listen to your children. As Rich said, it's never too early to start these difficult conversations with them. And again, I believe that an ounce of precaution's worth a pound of cure. So I would encourage you folks to bring your children to these type of events that the school is planning. But we as a school system definitely now need to kind of revisit what we're doing, where some of these programs were maybe at the high school level in terms of a high school health curriculum. We may need to start to revisit and say that we need to may creep that down into our middle school years as well.
How you doing? Like Dave, my friend Dave said, I just lost my 26-year-old sister. Beautiful girl, And what Rich was saying, don't wish, act, Don't wish, because I can only wish now that I acted. But my niece lost her father and her mother in a matter of 8 weeks from heroin. And I'm not giving up. If I can help one person by coming here and telling you, the only thing I could say is don't wish, act. But it's got to stop. It has to.
Rich, this question's for you. If the drug companies are aware of what the opiates are doing to our society, why do we keep on prescribing them, and why are we allowing them to make them? Yeah.
Well, there are legitimate uses for them. That's never going to change. There's injuries, there's disease states. I mean, we need them without a doubt. I think the problem is over the last maybe decade or so is prescribing patterns have gotten very easygoing. That's good relationships with, I don't want to throw doctors and hospitals and stuff under the bus or anything, but, we have a good rapport with our physicians. It's easier to obtain this stuff. You get 20, it's working, all of a sudden it's got your hooks in it. Well, pain's still there, I need 20 more. There's never going to be a cure for pain, so we have to have some type of a treatment option, and there are without a doubt legitimate cases out there. I think we just have to be more on top of educating people as far as what to look for, what to be cautious of, to use it as needed, and that starts at the physician's office. It goes right on to the pharmacies and on to the patients. I mean, there has to be some responsibility there. Well, the Suboxone that I spoke of, we'll take that for example, that hits the same receptors that the opioids hit. Unfortunately, it doesn't have, when it hits the receptors, it doesn't have the same response. So it's more of a blocker than a full responder to give the pain relief. The certain receptors in the body that need to be hit are only hit by opioids. I think the second, to go a little further on that, I think what we need to do is we need to take into consideration that all pains don't need a high dose pain medication. We need to start low and work our way up. I think you start seeing, patients doctor shopping, hospital shopping, looking for that 15 or 20 hydrocodones, oxycodones, whatever it may be, where an anti-inflammatory, an ibuprofen, an acetaminophen, which is Tylenol, something on a lower scale will do the trick and is going to have less potential to hook that patient and get the ball rolling. So, I mean, the one product that was huge in the media 6-8 years ago now, the OxyContin, when that was being pulled off the shelves, it was being rubbed out of the pharmacies, it was being rubbed out of people's homes. The manufacturer that did make a change to the formulation where it couldn't be crushed, snorted, or crushed and shot up. The ingredient that they put in there bound to the medication, and when it was broken down so that it couldn't be abused. But all that ended up happening was they came out with a short-acting product, and people would start taking advantage of that. There's always alternatives, and the people that are looking for it are always going to find them. Unfortunately, like I said, in society, pain is always going to be an issue, and it's always going to need some type of a treatment. So what needs to be made, what needs to be addressed is only going to be hit by opioid-type products. Okay?
Could you touch upon the methadone treatment, Rich, by any chance? Sorry.
methadone treatment is a little bit more intensive. It's going to require the patient to be registered within a clinic. You can't do or receive methadone treatment on an outpatient. Well, you can receive it on an outpatient basis, but you can't receive it at an outpatient pharmacy, like a retail pharmacy like myself or one of my competitors. They have to obtain the methadone for addiction treatment at a methadone clinic, which would be daily trips to that pharmacy. They check in, they sign off, they take the dose. The counselor that's there or the pharmacist that's there actually watches you take the dose, swallow it down, and out you go back the next morning. Methadone can hit those receptors in a way that can also give you that euphoric buzz or high. So as well as it being an inconvenience to the patient, it's a bit of a fix, but there are better options out there. Okay.
Hello. My name's Kevin Rosario. I'm the regional outreach representative for Gosnell on Cape Cod. I just came to show support. We do have an outpatient office in Brockton on Torrey Street. I just really came to support, but no one really checked in on the treatment side of things, so I felt the need to do that. These people that are addicted to the opiates, it's not a quick fix. It's not a medication. It's not a 5 days in detox. It's not a simple fix. The people that do the best, that stay in remission, usually require to be removed from it for a period of time. And whatever outpatient they decide to do after that may be more effective, but we're finding that people come into treatment for 3 to 5 days. 3 to 5 days, the insurance doesn't really, a lot of the insurance is what we're fighting for now is to keep them longer. You want to keep paying for detoxes and overdoses and emergency room visits, but like, why don't you invest in them and give them a chance for recovery? And what that really requires is to get them out of the environment and stabilize them. See, like the drug addiction, the way the brain gets hijacked from these opiates, that's just the initial problem. When you get the opiates out of their system, they're not just okay. They're not like send them to detox, get the opiates out of the brain, go back to work, go to IOP, you'll be fine. It's a lot more than that. There's all kind of underlining stuff. And there's a term for it. It's called post-acute withdrawal syndrome, PAWS. It could last months. Untreated, it could last up to a year of reoccurring anxieties and depression and fatigue and mood swings that go up and down that this patient and the family, not having the education, says, well, just do this or just do that. They don't get it. And this person is like on this roller coaster of emotions, and without any support, they're almost doomed to have a regression, because as painful as they know the addiction is and the problems that it caused and the consequences that come with that, to the patient who's suffering with untreated addiction, untreated emotional issues, it's the only relief that they have. People don't choose to continue to keep going back to drugs. They don't choose the drug over the family. Like I hear family members say, but we love them and we support them, and it's not a matter of choice. Once that brain has been hijacked, I use that word a lot too, because the brain starts to think differently. And the only things it knows is, if I just take this, I'll feel better for now, and I'll deal with whatever happens later. So I just wanted to check in on treatment. Like if you want someone who's in like full-blown addiction, that's manic, that they seem like there's no hope, there's definitely hope. But you got to get them in someplace. You got to get them into a place that'll give them a long, extended continuum care. The detox 5 to 7 days is just the beginning. Then we got to stabilize them. And then they can be seen by a therapist or a psychiatrist, a good one that's not going to just throw more medication at the problem, that's going to see them again in a couple weeks and reassess them. You know, a person in detox in the first few days, they look like mental patients. They're going out of their mind. You're just taking them off heavy drugs. They look very unstable. But those same people that are manic like that, after a couple weeks, after a couple months with proper treatment and proper assessment, they start to level back out. You know, but you need to keep them long enough for that to happen. You know, so I am available. I did put some flyers out there. I do have a business card. We do take all insurances. I didn't come here to plug. The beds are full. Business is booming, unfortunately. I'm not here to stir up business. I don't need business. I'm here to reach out to the community to say there is hope, that people do get well. And if there's any way I can help with that, we have the detox, and then we have the 30-day program. We have a men and a women's rehabilitation program. And you know what? I know that not everybody's going to be able to get into that, but the state of Massachusetts does actually do a pretty good job. There are a lot of halfway houses that are funded by the state. If you don't have money or you don't have insurance, guess what? It's not easy. But if a patient is willing and they've had enough, we can point them in the right direction. They can go to a detox and then to a CSS, and then they can go to a TSS, and a TSS is picked up by the state. It doesn't cost $1. It doesn't go billed to insurance. And you know what? You might sit there for 3 weeks. You might sit there for 6 weeks before you get to the state-funded halfway house. But literally, if a patient is willing to get well and go to any lengths to get well, they can literally stay in a safe environment for 4 to 6 months. And they can really engage in therapy and 12-step programs and holistic health and start working on diet and exercise and get those receptors back, pumping the natural endorphins that are already in there. But we need to give them a chance. There's no quick fix to it, but there is hope. And if there's any way I can help, please, see me after this. Thank you.
Brad, I'd just like to say one thing in regards to what he just said, and actually everybody up here, that your resources are everything, and if you guys take away anything tonight, it's that education is key and be proactive. Like Rob, you said, how do I address a situation if I think? Reach out. There's a lot of telltale signs that I'm sure, High Point or, his place can give you an idea of what to look for. I know the school system, you guys had the hidden in plain sight, which kind of gave the parents an idea of what to look for. Worst case scenario is you suspect it and you're wrong. Who cares? You'd rather be wrong and save somebody's life than find out later. Just be proactive.
Just to piggyback on that, Rich, congratulations to 10 years being sober. Can you just speak to what you did to get sober and what you're continuing to do to stay sober?
Well, thank you so much. I'm actually in my 10th year, and I'll tell you, it was a rough road in the beginning. And what I do to stay sober every day is things like this. I just try to give back to whoever I can. I stay active in my recovery. I still go to meetings today, and I don't take anything for granted because, in reality, I am one bad decision from going back out there. Just one bad decision. So I have to stay vigilant in my own recovery. I have to have a network of people. Like I could take my cell phone right now and call 100 people if I say I want to have a drink, and 95 of them would be here within 15, 20 minutes. I have to have that network because, the tallest building on this planet will fall without a foundation. So will I. And I don't want to fall again. I don't want to go back out there. The alcohol will always be out there. The drugs will always be out there. I just don't want to go back out there again. And again, the way I stay sober is I just remain vigilant. I constantly speak about it. I write about it. I talk about it on Facebook. I do whatever I can to just keep helping, keep creating awareness, educating, just keeping plugged in reality. Because, I can always unplug myself, isolate myself where addiction will want to have me, and go back out there. And I just, I've been there, done that, and I don't want to go back out there. The last a little over 9 years have been the best years of my life. I'm 47 years old, and the best 9 years of my life I just went by. And I don't take anything for granted. The clothes on my body right now, the shoes on my feet, the car I drive, the air I breathe, the job I have, the home I have. I'm grateful for every single thing. I go into Boston once in a while with a few buddies of mine, and we give away sandwiches to the homeless people in Park Street. And we sit there, and it makes us become grateful. We see these people, and we try to help them, and we give back to whoever we can, and that really helps me as a recovering addict distance myself from that last drink and keep myself away from the next one. Just for me, just doing the next right thing is the thing that probably keeps me away from that next one. And like someone said, I think the gentleman over there, the next one could be the last one. I might not make it back. And I want to speak just about that, what that gentleman said. There's so many stereotypes out there. I mean, he has a leather jacket, all patches, and people probably looked at him funny, And it's not even a joke, but people judge people from their looks. But you know something? I don't know I've never sat in his shoes. I don't sit in your shoes. You never sat in mine. We don't know what we're going through. You know, and it doesn't. We're all human beings. Take off our clothes. We're all human beings. We all have a heart. We all have blood. No one's better than me, and I'm no better than you. We're just people on this earth trying to survive one day at a time. And for a person like me, or a person, or another addict, or an alcoholic like myself, we struggle every single day. So, you know, and someone also said about addiction, you know, it's not just the guy under the bridge anymore. It's the little girl who played dolls with your daughter. It's the little boy who played G.I. Joe in your backyard with your son. It doesn't discriminate. So I don't mean to get off the question, but that's what I do to stay clean one day at a time.
Hi, I have a question in regards to, I understand how heroin is just taking over, but what really is, what I feel like we're not touching on is marijuana. And I feel like that, to me, is a huge gateway. And with the police not being able to do what they used to be able to do, and it's almost becoming a accepted drug, and I feel like this is also leading to what we're all talking about here. Can anybody help with, you know, where are we going with this marijuana? Do you think that this is kind of a gateway to where we are today?
I guess I'll take that one. I believe it definitely is a gateway drug. You know, again, when I speak at schools, I talk to some of the kids after, and they smoke weed before school, and you know, sometimes they sneak out and smoke weed. It's definitely a gateway drug. Alcohol and weed, I believe in my heart, and you know, I have opponents for this too that don't think it is, but I wholeheartedly, in my heart of hearts, believe that alcohol and marijuana are definitely gateway drugs to more severe drugs. Like you know, we all talk about the opiates, but there's other ones out there. There's meth. Meth is getting big out there. I know a lot of people that are on meth that started drinking and smoking the weed, you know? And someone just doesn't start using meth or heroin or crack when they're 20 years old. Very rare. I shouldn't say never. But they start off in the backyards having a party when their parents are away, or when, like someone said, when they open up that medicine cabinet. But there's so many gateways out there that people can go down, or kids can go down. And I believe marijuana right now, honestly, a lot of people smoke it. Like you said, it's becoming a normal part of life, a normal part of our culture in a lot of people's lives. That they just go home, smoke up some weed, and go to sleep. For me, it's unbelievable. And, you know, again, when I speak to some kids, their parents smoke weed, and they know it. You know, how wrong is that? You know, I can't fathom that concept. But yeah, weed, alcohol, definitely gateway drugs in my estimation, without a doubt. I'll tell you this: if I didn't start drinking at 10 years old, I don't think I ever would have done any drugs. If I stayed away from that alcohol, which is a gateway, I don't think I ever would have tried harder drugs. I don't think I would have. You know, but I wanted to drink more, so I wanted to do this to make myself drink more. So I tried that gateway, which opened the door for more drugs. You know, it's yeah, there's a lot of gateways out there, and I believe marijuana, in my estimation, is definitely a gateway drug.
Thank you, Rich.
Just touch upon the police side. I've been on long enough. When I first started, marijuana was completely criminal, and I do see it increase as far as people using it. From before, you know, if they used it, they'd hide it more. Now it's decriminal, and people, as it was touched upon earlier, they think it's legal. It's not legal. It's just decriminalized, and they do limit our power and what we can do with it. We still try to do what we can. We try to explain it, and also driving while after they smoke is becoming more of an increased thing where they don't understand the impairment behind it, so they can still be an OUI drugs aspect. We are doing the best we can, but society itself is viewing it as a lesser drug in a sense, but it is a gateway drug. And I've also been on long enough where I've seen the kids we used to start seeing it or dealing with them smoking marijuana are now into more serious drugs. And most of them will tell you that they started with drinking and marijuana. It does limit us, but we are doing what we can. We do have the citations we can write, and we are applying it criminal when we can. We have a task force that still addresses any of the illegal distribution of it. It's just as it gets harder and harder and more case law gets established that's taking power away from us, we can only do certain things, but we are doing what we can.
I just wanted to make a point, I guess, about the marijuana thing. I think the reality is that most kids will try drinking before they try marijuana, and nobody ever talks about making alcohol illegal because so many adults love it themselves. They enjoy drinking it, so nobody wants to take it away from the adults. But we want to sort of demonize marijuana as so much worse. Really, they're both drugs. They're both mind and mood-altering substances. If somebody has that genetic predisposition to be an addict, it doesn't really matter what they start with. It's going to progress in most cases. And I think that so many kids experiment with drugs and alcohol, and it's like a roulette with, are they an addict or aren't they? Are they set up to be an addict or not? Some kids are, some kids aren't, but they are experimenting. And personally, I don't think it matters what they start with, whether it's, you know, pills from the dentist, drinks from mom's cabinet, or pot from the kid up the street. I do want to say something else, too, which is that part of what's happening in a lot of communities is that there's coalitions that are being formed. There's a lot of work to do around this issue. There's so many aspects to the, you know, we're calling it an epidemic now because it's reaching so many communities, but this is a really old problem. And there's so many things to work on, and it takes communities, whole communities of people coming together like the police, the schools, the medical field, and just people like us to make real change happen in the community, because it's a community issue, so it needs a community solution. And so I would love to see if the next step for some of the folks that are here that are really interested in helping is let's talk about getting a coalition together for Bridgewater. There's a lot of good coalitions that are already doing a lot of good work. We don't have to reinvent the wheel. We can work with them and learn from them and make some real change happen right here in Bridgewater.
So you articulated that very well. Thank you so much. I just wanted to mention that, so Bridgewater was just recently funded to address underage drinking and other drug use. And we're in the assessment phase right now as we speak. But there is a coalition in Bridgewater, and Officer Heil can give you some more information about the coalition once, in a little bit, but I just wanted to say it is part of the Brockton Area Opioid Abuse Prevention Collaborative, which is a regional coalition that's addressing these issues. And you are all more than welcome to be a part of the Bridgewater Coalition. 1 second.
We are holding monthly meetings right now at the police department. It started back in July 1st. I believe the funding kicked in. So we've been doing it. The grant right now, I believe we have a plan that goes through. It's got to get approved in January, and we're going to have more action take place in April, and it's going to have the school involved with possibly, that's part of the curriculum that's going to be taught. A lot of things we have, and we're part of a regional group such as East Bridgewater, Hope, Whitman, Will, Rockland Cares, Brockton's in there. They all have the same, in town itself, they have a group, and it's part of the regional group, all through the High Point, the Opioid Overdose Prevention Collaborative. So we are getting funded through state or federal grants, and we are meeting monthly, and we want the community involved. It's a community problem, which clearly it's been established tonight, and it has to be a community solution, so everyone's got a different point of view and different things that can come about, different programs that can come out above it. If you want, you can see me after, and I can take your info. I'll tell you when the next meeting is. If you can go, and I can take your email, or you can email me, and we'll throw you on so we can keep you updated as far as what happened at the last meeting if you couldn't be there, and when the meetings are taking place, and it'll be monthly meetings from then on.
Okay. Hi, my name is Brian. I came with the Teen Challenge organization tonight, and I just have this overwhelming urge to speak and comment on everything that I've heard and seen transpire tonight. First of all, I can tell you that I'm a recovering addict myself. I'm part of the Teen Challenge program. I've been in recovery for 12 months. A lot of things. Thank you. I'd like to just, kind of, I guess the word would be plug Teen Challenge right now and tell you that, that you don't need insurance or any money to come into our program. I didn't have anything that got me in. And as far as like my view on what's happened, I can tell you, a year ago, 2 years ago, I was taking Suboxones and methadone to get high myself, and it wasn't helping me. I tried to go to other programs to work 12 steps, and I guess that works for other people. But for me, the only thing that's helped me was Jesus Christ. And I want to tell you guys, if you guys want to do something, you really want to get involved in your community, is to come down and bring your family to church on Sunday, bring your kids to church, and you pray for them, and you live godly lives and be an example to them. And I can tell you, all I know is that Teen Challenge has worked for me and for all my brothers here. I thank you for the chance to speak.
I'm hoping I can say a few words. I've kind of taken a few notes. All the things that I've heard here today are wonderful, and it's a start. And I know many of you up on that panel. I am an ER nurse. I work at the Morton, and in Taunton, I see the overdoses and the effects of drugs every single day. But 37 days ago, I had to go to Amanda's group that's called GRASP because I lost my 19-year-old son, who is a triplet, who attended Bridgewater Rainham High School. He'd had problems for a while, we knew that. He also suffered from bipolar, which is one thing we haven't touched on, is that many of these addictions are secondary to a dual diagnosis problem. There's an underlying problem. It's an anxiety problem, it's a depression problem, and your kids aren't going to tell you about those problems. They're going to act out in school, they're going to drop their grades, they're going to get into fights, they're going to have mood swings. These are the things that you're going to look for. I know that when he was around 15 or 16, he experimented with marijuana, and then it went on to alcohol. And in the last year and a half, he went to alcohol and cocaine. He has been in and out of detox for the last 2 years. He'd come out, he'd be clean. I'd put him back in, and we've had a cycle. And he did not want to use drugs. He wanted to be clean, and when he was clean, he looked good, but he couldn't do it. He kept going back. He was seeing a therapist, he was on his medications. We were doing everything we could to keep him alive. Like I said, he's a triplet. He has 2 other brothers who are BR graduates, successful in college right now. So when someone had talked about the gene for the dependency and for the addiction, Jeffrey got it, the other 2 didn't. You don't know. You don't know which child it'll happen to, but it can happen to any of them. I did all the things that you people have talked about today. I put my son on a Section 35, which was 30-day hold, which was, I have to tell you, an awful experience because they go to Bridgewater State Prison. There needs to be a lot more work done in the Section 35 programs because at the end of the 35 days, they were trying to transition him to a longer-term program, which they are calling the not the transitional, but the longer term. My brains just went dead, but it's okay. The day before he was scheduled to go to one of the holding areas in Taunton, they needed beds in Bridgewater. They kicked him out and threw him back to the courthouse, and he did not get his long-term bed. He lost it. Within 2 weeks, he was back to drinking and using cocaine again. And this is how, unfortunately, the system is working. It is failing our kids. We're doing a lot of preemptive work now in the forefronts, but the treatment plans, the treatment post-term is bad. He went to, and I'm just giving you guys some examples, and I won't keep you talking, but he went to McLean. They kept him 4 days. The insurance kept him 4 days. He needed to go to an intermittent transitional program. There was nothing in the state of Massachusetts. They moved him to Rhode Island. He went to Rhode Island to a TCC, and he stayed a month. He once again needed to come to get into a long-term residential program. He had to go to a holding. I couldn't get him back to Massachusetts because the insurance company sent him to Rhode Island, so he no longer qualified for a TSS bed in Massachusetts. He's been raised and born in Massachusetts his whole life. They sent him to a homeless shelter in Westfield. And if any of you parents have ever walked into a homeless shelter with your 19-year-old son, I couldn't leave him there in the middle of nowhere. He came home. We went to AA, we went to treatment, we did it. A month later, we're back again. So it's a cycle, and you cannot give up. This last time he was clean and sober, he had gotten out, he was doing really, really well. And one day before his 20th birthday, I think he went out to have a few drinks, which was the week he was beginning to start to relapse. It had been about a month, so that was good for us. We still don't know what happened the next morning. This is not a boy, to our knowledge, who was using heroin. His friend said that was not his drug of choice. It was drinking and cocaine, which, by the way, the kids use the cocaine because they stay awake longer and they can keep drinking. So those two drugs go hand in hand. What I am told is that the next morning, because he was at a young girl's house who was 17, living with a grandmother, but they were drinking there all night, is that they got up and they smoked a blunt the next morning, and this takes us to the marijuana. That blunt was laced. They believe it probably had heroin and or fentanyl inside of it. He didn't wake up that morning. I'm told that they did not know that it was laced. I don't know whether that's true or not, because I'm going to tell you, when you talk about asking your kids the truth, the addicts, you guys, you lie to us, and you lie really well. You can look at us with really good faces, and you lie really well. So my son is gone. I won't know probably for 9 months, because the state is so very over-inundated in medical autopsies that you can't even get the results for a cause of death because of such high amount of deaths in this state. The other thing I wanted to say on education with your kids, now that Jeffrey's gone, I was able to get in and access his Facebook, which actually takes an act of God, I must say. When your child dies, you do not get permission to get into his Facebook. Educate yourself. Go up to the urban slang on Google and look up slang names for drugs. You would not believe what these drugs are called. Hard, soft, brown, trees. I can go on, but you will not ever know that your kids are talking about drugs because they're not calling it heroin, cocaine, or alcohol. That's not what you're ever going to hear. And they have a whole code name and a whole list of words. I'm sure the police know a lot of those slang names, but they all know exactly what they're talking about when they're texting back and forth, and you wouldn't understand. You'd think they were just talking about a beautiful green tree growing in the backyard. So educate yourself, get online. Drug testing, I did mandatory drug testing up until a month before he died with the courts. And I think maybe that was helping us to keep him really straight, but he was so happy to get off drug testing. So it doesn't matter if they hate you and they don't like you, because it's keeping your kid alive. And my other two boys now have lost their triplet, their brother, and we've lost our son. And I will do anything I can to help get that education out there. And I just thank you guys for all being here and showing some support. And I'm sorry, I won't take up any more of your time, and thank you to everybody here, okay?
To also mention the group that she was referring to called GRASP. If you have lost a loved one to the disease of addiction, there is a grief support group that's held in East Bridgewater. It's the second Thursday of every month from 7 to 8:30 at the Community Covenant Church. And it's a peer support group for families who have lost somebody.
Hi, my name's Christine McMasters. I have a 29-year-old son who is an addict. He's been in recovery for 2.5 years. doing very well, thankfully. But thank you. What I want to say to everybody is a lot of people, especially in the beginning, they feel like they did something wrong. To all you parents who think you did something wrong, you didn't. We went to church together. I'm a CCD teacher. I lecture. I'm a Eucharistic minister. I went to all my children's sporting events. I helped out in school. We ate dinner together. You know, we go to church. We talk about God and family. And I will say, even my son, when he was in active addiction, I never felt unloved by him. We were very fortunate in that way. So basically, I just want to let everybody know you didn't do anything wrong. You can't fix it. And we're also members of a wonderful group called Learn to Cope. I don't know if you hit on that tonight because I came in late, but for any parent who's looking for support, just as you have in this room tonight, there are many chapters around the state of Massachusetts. They even have one in Florida, which our son lives in Florida now, and we actually spoke at the chapter down in Florida. But there is a lot of support out there for parents, and you can't, just like you didn't cause it. One time there was a speaker at one of our meetings that said, there is nothing you can do to make me stop using drugs. And at the same time, there is nothing that you do that makes me do it. So you didn't make them do it, and you can't stop them from doing it. It's a difficult battle. My son started using around the ages of 18, 19, and he didn't become sober till he was 26. So lots of detoxes. We weren't educated, my husband and I. So the other thing that you can do is come to forums like these and educate yourself. But again, there's nothing that you did. I'm sure you're all wonderful parents. You wouldn't be here. And the other thing is you can't love them out of this. You can't do it. You need the support of the professionals.
Hi, my name's John Kimmett. I'm a person in long-term recovery. I'm a member of South Shore Peer Recovery in Situate. And my question's for Chief Del Monte. You mentioned all the lives that you were able to save with Narcan, and you know, thank God that that's available. My question is, it seems to me that it's a perfect time in the course of someone's disease to try to intercept it. And I'm just wondering if there's any protocol where they would be introduced to the possibility of getting into treatment. Because I know that they don't stop for Chinese food on the way home. They leave the hospital and they're dope sick. And that's the last thing they want to be. And from my personal experience, because I've worked with some of the people, they're at a point where they're very often receptive to getting into treatment. We've had, through cooperation with the Situate Police Department, we've had like 30 referrals, and 2/3 of them have gone into treatment, some of them the same night. So I was just wondering if you've had any.
Well, it's a good question, John. I think that your perspective is very valuable here, and it's something that's not lost on us. As we said, we're trying to do things differently than we've done in the past, and one of those is recognizing that we can do more. So you raised the issue about Narcan. That is not the panacea, as you know. It is just one of those things that I'm shocked that it took us this long in our profession to realize that this is something that's life-saving. And so I don't know that because we've had 7 fatalities in our community that we're successful. In my eyes, that's still a failure. There's often a lot of it we don't control, but it's certainly a step in the right direction. And of course, treatment is a big issue. I've gotten many requests. I've had many people who have asked me about the Gloucester model, and I don't know if you've had a chance to discuss that here at all, but The chief up in Gloucester has instituted a program which essentially grants amnesty to people that come into the police station seeking treatment. And it's really an experiment that I've tried to follow and see what its successes were and what its failures were. And I can tell you what the main concern I have is with a program like that is I'm hesitant to say to anyone that if you come to the police station, I can guarantee treatment for you, because I cannot. And so I think what we need to look at is there are many facets to the problem, as you say, and we are looking at all those facets and see what we can do differently. So as a young lady had mentioned here about her son, I spoke to you about the parents that had come into us and said, look, I have this problem. The stories were very similar, and their hearts were bleeding in front of you, and there was only so many things that we could do as a law enforcement agency to help them. And so now I don't see it as a change. I see it as an evolution. We've evolved, and we've understood that we can play a bigger part in giving direction and getting treatment and trying to get help. But the failing that we start out with is there is not enough treatment out there, and the methods of getting you to that treatment, that is a significant problem that is really outside of our control. We are fortunate, though. I joke with Amanda, we rely heavily on her and people such as herself who can give us that guidance and direction, which in turn helps you, and we provide that. We're really, we're on the street corner directing traffic. We're doing the same thing, I think, in many ways with our social service agencies. We're directing you in the appropriate places. We want to make sure that you're getting, or the person that's suffering, or the families for that matter, the help that they need. So that's what we're looking at. And just to get back to what they're doing in Gloucester, I think there's a lot of value in that. And if you'll notice, there are pamphlets in the back of the room about East Bridgewater Hope, which is a nonprofit group that is working in East Bridgewater that is really addressing a number of problems, and you'll see in the flyer there every other, I think it's first and third Thursdays, they offer services at the church over there in East Bridgewater. Rather than reinventing that wheel, we are suggesting, and we are simply attaching ourselves to that. So we're making recommendations for people to use those services that are already available in a local place. So there's a number of facets to what you say. We're trying to do a better job at giving guidance to people that are struggling. I hope I answered your question, John.
Good evening. My name is Raymond Gowner. I'm 48 years old. I'm the second oldest student at New England Teen Challenge. And in 1970, the United States government did a survey of all the treatment programs in the United States. The government itself gave Teen Challenge an 85% success rate for all their graduating students, and every other treatment program received 4 to 6%. And that's because they didn't use the Jesus factor. The clinical field tries to give you this myth that addiction is a disease, and in order for it to be a disease, it has to come from somewhere. Like, heart disease, cancer, encephalitis, syphilis. Addiction is a heart disease condition. We as addicts love the way the drug makes us feel, and we continue to use it. And Teen Challenge, it teaches you how to take the love for the drugs and the way it makes you feel and place it in a power greater than yourself so it can restore you to sanity. The Bible says that you're supposed to love God with all your heart, mind, soul, and strength. And when you do so, the addiction is gone. I have 16 months clean. Here are and 1, 2, 3, 4, 5, 6 of my brothers. I think if we put all our time together, there's probably about maybe 10, 15, 20 years. And as parents, there is something you can do. You can pray, because that's one thing that God will hear your prayers. My mother is dead, my grandparents are dead, and my father is sick. So their prayers got answered. I'm 48 years old. I'm standing tall. I'm about to graduate Teen Challenge and go on to North Point Bible College for 4 years to become a minister. Don't allow people to tell you that addiction is a disease. It's not. You parents who are in the room, you continue to pray for your children and cry out to God, because when the children of Israel were in bondage in Egypt, God said he heard the cries and he set them free and he sent Moses. So now Jesus still stands. Put all your trust in him, and believe me, he will answer.
Over here.
Really had to follow that. Sorry. God bless you. I guess I'm more curious about, obviously, my best friend lost her son. My ex-husband was an addict. He's about 1.5 years clean. He had to move completely away from everyone to do it. That all being said, what do you do with the drug dealer? How we're actually making this like so human and so easy for the addict to get help. Now, don't get me wrong, a lot of them are your children. I have children too. But what do you do to the person that killed them? Because reality is somebody's selling them a drug, somebody's making that drug in a bathroom, or they're moving it from one place to another, and they're selling it to our children, and they're selling it to our husbands, and they're selling it to our sisters and our brothers and our cousins and our friends, and they're all dying. So what's the legal ramification for it? Because at some point I grew up, and if you did drugs, you went to jail. You went to jail. I don't understand. I think that if we keep making it easier and easier and easier for everybody to accept it and to not look at them as there's no criminal activity here. There's a lot of criminal activity here. And these people are killing our children. That's where I want to know. That's what I want the most, is an answer to how do you stop this and make the kids think that it's not okay. It's not okay. It's never going to be okay. And if they use it, yeah, there's a treatment program for it, and don't worry, so-and-so's sister and somebody else's brother and somebody else's child died, but they got help and they're okay now. Well, along the way, they hurt a lot of people. And then there's people that are killing people. They're killing them.
What do you think, Chief?
Well, you ask a very good question, and I can tell you that one of the things that we didn't talk about, well, I was away for a little bit, but one of the things that we didn't talk about before I left was there are several components to this problem. What we're talking about tonight is issues of treatment and education, which are critically important, as you know. But one of the things that we haven't talked about is enforcement, and that is not something that we as a police agency, and I don't think law enforcement has forgotten about, because it's important as community caretakers that we are to recognize that keeping these drug dealers out of our community is just as important as being able to get them to the treatment they need or trying to help them along that road. Keeping those people away from them, are we going to solve the drug problem in this community alone that's a scourge in this state and across this country? And the answer is no. But the one thing that we will do is take that type of offense and treat it as seriously as it should be, to try to keep those people away from our kids and people in this community that have a problem. Don't make it any easier for them, and that's something that is not forgotten on us and something we continue to do and we will continue to do. That policy has not changed.
But I need help. I'm an addict.
Well, one of the things, first of all, you're referring, I think, a little bit to that Gloucester model, which is amnesty for those that come into the police station. Is that what you're referring to?
Or, they get arrested and they go in front of a judge and they say, I'm an addict, I need help. That's why I sold it. Because I think that you're actually giving them a loophole. I don't know, that's just a personal feeling, and I'm empathetic to the fact that a lot of people need help and that there has to be there, and I'm thrilled that all these people are here. I'm thrilled that everybody is listening and paying attention, because I've been saying for 2 years it's epidemic, it's going to hit a head, and it has. So it's time that everybody pays attention, but I still don't understand how we can give them all that help and then decriminalize the fact that there's people out there that are selling it to your kid and they don't care if they live or die because there's 5 more people that will buy it behind them. I might have killed Johnny, but I'm still going to sell it to Billy and Eddie and Mike and Sue. They don't care.
That's a legitimate issue. I can tell you one thing I have seen a change in, and that when it comes to the prosecutorial side, or the enforcement side, if you will, there has been a change in policy when it comes to prosecuting people that are giving our children these drugs that ultimately they are killed by. And the prosecutor's office, it's a difficult thing to do, but the prosecutor's office has taken a different approach to that. We're trying to backtrack these drug dealers. They don't just get off because they've sold it and moved on. Meanwhile, the person that's suffering is either injured or deceased. So they have taken a different approach. That's what I've seen from the courts and our prosecutor's office as well, trying to be better problem solvers.
All right, other questions?
Hi, sorry. I got my composure so I can a little better now. Chief, this goes to you and also Rich. I have 2 points. I was lucky enough to get my sister's death report back, and she died of an active fentanyl. My sister was receiving treatment, and the mixture of the fentanyl with her treatment was ultimately killed her. And she went out. Is there going to be, like she just touched on, the prosecution of a drug dealer that's going out and selling fentanyl? I mean, to me, selling heroin, you should be locked up anyway. But if you're selling somebody fentanyl and it ultimately kills them, in my opinion, and you know, I know I'm just one guy, but that's a death sentence. I mean, you know what I mean? It's not fair. He shouldn't be selling the drugs anyway, but to sell somebody something that's ultimately you know is going to kill them, to me that needs to be addressed. And the other one, Rich, was the Narcan. I agree with the Narcan, but I've heard that these people that are doing this, now it's just the ultimate rush because they readily have Narcan available. So let's go all the way to that point where I can bring myself back. My sister had a Narcan in her kitchen, in the drawer. But yeah, guess what happens when you're doing heroin alone or fentanyl, whatever she did? You're dead before you can get to that drawer. I mean, it doesn't make sense to me, and I probably never will, but I wanted to raise that point.
Well, it's definitely, like I said, it's not a fix. It's, in certain situations, it's a help. Obviously, she can't administer it to herself. And unfortunately, to some addicts, I think they're seeing it as an out, saying, it's a rescue. I can do this, there's no repercussions because I have the Narcan in the house. If they're by themselves or they're with somebody else that's using, that's not going to matter. There's been instances in local towns where there have been people side by side that have, used, OD'd, and have been found, 2, 3 people at a time. But in a situation where either parents, siblings, spouses, maybe home, it might buy the person some time until EMS can get there. Like I said, it's definitely not a fix, but hopefully it's just a tool that, as a society, we can use to help.
A person in active opioid addiction is going to use an opiate whether they have access to Narcan or not. In my opinion, Narcan just enables a person to have more often have another chance at recovery. They have another chance to live. They have another person might have a chance not to. I'm so sorry about your sister and your brother-in-law, but that's one more person that might not have to bury their sister or their brother-in-law. It enables the person to have another chance at recovery, and that's just my opinion.
All right, I think we can take one last question. Oh.
This isn't a question so much as just something that I want to say. My name's Megan Perry. I'm a person in long-term recovery. I went into I want to speak very briefly just about that this happens to anybody. I grew up in a wealthy seaside suburb. I got great grades. I went to college a year early. I studied in Europe for a year. I came back. I tried heroin. And when I graduated from college, I went to detox, my first detox 3 weeks later. This drug does not discriminate. But I want to speak to the issue about drug dealers and what do we do with drug dealers. And I know that there's a lot of pain and there's a lot of loss because of the drugs that are out there, but we are never going to eliminate the supply of drugs. They're illegal, therefore they're highly profitable, and for every drug dealer you lock up for the rest of their lives, there's another one right behind them that's going to take their place. And so I think we really have to look at reducing the demand for it. And I also want to say that there is a difference. There are drug dealers that are out there strictly for profit, just to profit off other people's suffering. But the majority of low-level, nonviolent drug offenders are drug addicts. I'm one of them. I have a felony conviction for drug trafficking because I sold the drug of my choice to my friends so that I could supply myself. And I was offered an alternative to sentencing. Instead of going to prison for 2 years, I was allowed to go to a 9-month residential faith-based treatment program. And that's why I have 4 years clean today. So we do recover. We need to give people chances, especially people struggling with addiction, whether it's more chances in treatment, more chances, and whatever the solutions may be, but also chances to make good on some of the damage that we've done. And today, my whole life is really about recovery. I work in the treatment field. I do lots of advocacy. I come to places like this and tell you that I am a convicted drug dealer because I want people to help people understand the scope of the problem, the face of the problem, and that there's so many different ways in which this affects us all and different ways in which we can help and make a difference. And so I just really felt that I needed to share that because not all drug dealers are equal and there is no one way to treat that situation. Thanks.
Thank you so much. Okay, one more question.
All right, this isn't really a question. My name's Ashley Hoyt, and I'm 16 years old. And I just wanted to really invite you guys to, whenever we have a next forum or whenever we have something like this, please invite your teenagers, your kids, who are really on the forefront of a lot of this problem. We're often seen as the target, as the enemy, like we need to have them under suspicion. And it's not always the case, and I really think, bring them, whether you think they might be doing drugs or they might not. They might see, success in finding help or loss in not. Or they might not be doing drugs and they might need help with friends. I see classmates with cocaine all the time, and I need to know how to help those people, if they are my friends, if they are my classmates, where to go. And I'm on the forefront of this. And your kids or your grandkids or whoever, they're on the forefront of this too. It's a real problem. We need to not just take this as adults, but also as teenagers and preteens. We need to come at this as a team, really, instead of just saying, oh, you're a kid. We're going to keep this elephant out of your, you don't need to worry about this. Us, adults are going to take care of it, because it's not the case. We need to know what to say, we need to know what to do, and we need to be treated as adults in the way that we need to know the situation and how to fix it.
That's awesome. Thank you, Ashley. Thank you. All right, and in closing, we do have at the back doors, we'll have surveys if you'd be willing to fill out a survey. And I also just want to take this opportunity to thank you all so much for your time and all the resources. And a huge thank you to all of you who have come tonight to be one in community to combat this horrible, horrible epidemic. Blessings to you as you leave tonight, and be in touch with each other.